Hello everyone, I'll be discussing on the drug chloramphenicol today. It's an antibiotic that belongs to the group of antimicrobial that inhibits the protein synthesis. It is effective against both gram-positive and gram-negative bacteria. Let's look into some of the indication. It is used for the bacterial conjunctivitis and otistic externa. It is used for the severe infections such as rectocele illnesses, meningitis, and it is also used for the typhoid fever and cholera. Mechanism of action. Chloramphenicol binds reversely to the bacterial 58 ribosomal subunit when it interacts with ribosome. Chloramphenicol, once it attaches itself to ribosome, inhibits the creation of peptide bonds between amino acids. The elongation of developing protein chain during translation is prevented by its interruption. Stopping the synthesis of new peptide bond will stop the production of new protein, hence preventing the bacterial growth. Pharmacokinetics. When taken orally, chloramphenicol is observed from gastrointestinal tract. Peak plasma concentration is typically reached after 1 to 2 hours. It's important to note that food can affect its absorption, so it's often recommended to take on an empty stomach for optimal effectiveness. Chloramphenicol is distributed widely throughout the body, penetrating various tissue and fluids. It occurs from blood-brain barrier, making it effective against the central nervous system. It enters the eye, crosses the placenta, and enters breast milk. Chloramphenicol undergoes metabolism in different ways. In the gastrointestinal tract, it's hydrolyzed to the free drug from when it's taken orally. In the liver, it undergoes conjugation with glucuronic acid. After peritoneal administration, such as intravenous, the lungs and kidneys are involved in its metabolism. Chloramphenicol and its metabolite are primarily excreted through kidney via urine. 3% is excreted through bile in feces, 1% in an inactive form via feces. The elimination half-life of chloramphenicol typically ranges from 1.5 to 4 hours, indicating that it's relatively short-acting. Let's look into some of the side effects of chloramphenicol. Stinging and burning after instillation for a person who is suffering from conjunctivitis, hypersensitive reaction, skin rashes, fever, angioedema, and the gastrointestinal tract irritation will cause nausea, vomiting, and diarrhea. Anemic have fatigue, weakness, paleness, and increased susceptibility infection, causing the superinfection. Another side effect of chloramphenicol is metabolic acidosis, neurotoxicity, and in infant with the lack of hepatic enzyme metabolism may cause the Graves syndrome, causing the anemia, cyanosis, vomiting, hypothermia, cardiovascular collapse, and immediate treatments are needed in severe case. A diagram shows a green indicating for most common and red for the rare adverse effect. While taking care for the bacterial conjunctivitis, use one eye drop every 2 hours while awake for 1 to 2 days, and for adult and child for the bacterial blepharitis, apply eye ointment to the eyelid margin once or twice daily for 1 week. While caring for a patient, prescribe intravenous chloramphenicol for bacterial meningitis. Start by performing the baseline assessment during vital signs and prevent symptoms like headache, stiff neck, confusion, and light sensitivity. Then review the recent laboratory test results such as renal and the liver function, blood cultures, and diagnostic results including cerebrospinal fluid analysis, and lastly confirm the prescribed dose by calculating the medication in mg per kg by day. Chloramphenicol belongs to Schedule 3, especially when it's used for treating the bacterial conjunctivitis, and it is used for the treatment of otistic externa due to a sensitive organism, and it can belong to Schedule 4 medicine when it's used for the treatment of infection due to susceptible organisms such as bacterial meningitis, typhoid fever, and rectocele illnesses. It is prescribed by the medical practitioners, nurse practitioners, and ophthalmologists. Now let's move on to the client education. Explain to your client that medication will treat the infection causing their symptoms and that the medication will be administered intravenously every 6 hours. Then review with some common side effects they may experience, such as nausea, vomiting, and diarrhea, and reassure them that you will be monitoring them over the course of treatment. Next, when administering chloramphenicol, ensure your client has a patient IV in place. While infusing the medication, monitor their CBC and serum drug concentration and insertion site for the local reaction. Let's test your knowledge on the chloramphenicol. Which of the following is a side effect of chloramphenicol? What is the primary concern associated with administering chloramphenicol in infants? The answers are: thank you for your attention and listening to my presentation.